Hello and welcome to another episode with Nurse Amy. So today I decided to do this topic because I've been asked over and over again. Remember, I did tell you guys I'm going to be doing some questions and answers, Q&A. And one of the questions that I get a lot, not only in my classroom, but also in my emails, is where should nursing aides work when they come out of the program, the CNA program? Should they work in a nursing home or in a in the hospital? So my answer is kind of twofold. It actually depends on you. Now, if you have been following me on my social platforms and either on my YouTube channel or my podcast, I have mentioned that very early on in my nursing career, I did work in the hospital, and I did. It was fine. It was okay. And that's where I got introduced to the healthcare system as it relates to scrub lifers. That's what I call us, those of us who wear scrubs, and that's how we earn our livelihood. So the experience for me was it was interesting. I learned very early on, the very nature of healthcare. And that's where I actually, again, if you've been following me, you will know I'm actually working on a book called The Bullying Culture of Nurses, Healthcare Experience. So, and I think that's where firsthand I got um, exposed, or I got the experience of this bullying culture, not only in the nursing department, but healthcare in general. I have shared my experience as a CNA, how nurses were mean. I've seen them be mean, not to only me, but to other people. And I've also seen how doctors treat nurses. So in the hospital, you find all those different strata of hierarchy. And I think I pretty quickly learned early on that I really didn't care much for that. So I did make a transition. It was smooth nonetheless to nursing home. And I'm trying to remember why I actually moved to a nursing home, because really it's just a different type of bullying, it's a different type of dynamic, it's a totally different beast. But I think I think it was, oh, I remember now, because I got a position as a treatment nurse. Oh God, I'm going to talk about that one of these days, my experience doing that. And that's where I think I must have gotten hurt. And now I do live with chronic lower back pain and sciatica, which can be very debilitating sometimes for me. I also will be sharing with you some of the things I've been using to cope with that pain. And if you have anything to share with me on how I can cope with my pain, please feel free to do so. So, where should a CNA work after they leave the CNA program? It depends on what you want to do. Working in the nursing home or working in the hospital are two different things, really, it is. Now, some people I do know transition between the two, they move between the two facilities. It's entirely up to you. I will say this: if you're thinking of going on to nursing school and you really want to have a career, management, and probably more professionally advanced career in nursing, then you probably want to try and get work in the hospital. Why is this? Well, in the hospital, you are exposed to a lot of experiences that you will eventually need to know in the nursing school. So say, for instance, I do know when you work in the hospital, you do things like checking blood sugar, okay? You do things like drawing blood. In some hospitals, they'll teach you to do that. You do things like even wound treatments. I have been told by some PCTs, they're called patient care technicians, PCTs. It's just name, okay? They're nursing assistants. However, they have some kind of advanced training because they're in the hospital, and it's more quick pace, quicker pace, if you will. So if you are thinking of going to a nursing school, then you might want to do that and then work, work in the hospital, and then advance in your nursing career. Also, like I said, if you want to follow that strictly professional path where you are going to do some advanced nursing licenses, like going on to be a nurse practitioner or um, teach in the nursing field, things like that, advanced learning for nurses, then you might want to do a hospital. However, I will say this also, it's not cast in stone. You can still work in a nursing home and still be able to do all those things and more. All I'm trying to, again, compare. If you're working in the hospital, there are things you're going to be learning in nursing school that because you work in that setting, that hospital setting, you're more at home. You're more familiar with medications, with treatment techniques, with certain nursing intervention. And you're also more astute, if you will, if you do take advance of the training you're getting, because basically that's what it's going to be prior you get into nursing home, is how to interface with doctors, with nurses, and with patients. In the nursing home, it's it's a totally fast-paced and ever-changing pace. So it's the acute care setting is in a hospital, and you find that it's like a revolving door. You find people moving in and out because it's short-term stay. So when they get balanced, meaning they have been whatever brought them to the hospital, they're now stabilized, they're immediately shipped to either their homes, to the nursing home, a rehab home, or some other place where they can recuperate. In the hospitals, you don't do that, okay? Unless you have some standalone rehabilitation centers now that are kind of becoming common, okay? But if you're thinking of going to nursing school, yes, or medical school, then yes, you want to probably be in the the hospital care setting. The nursing home is more, you're dealing more with chronic illnesses or chronic conditions, which pretty much are not changing. And so there isn't that much room to learn new technologies or put to use some of the things you're learning in nursing school that you're thinking, oh, well, when I go to my nursing home, I'm going to see this latest technology. I'm going to see this type of dressing. I'm going to be able to do this type of interventions, or I'm going to see this type of medications. You're not going to see that in a nursing home. Most nursing homes don't do that unless you work in a rehab floor in that nursing home. But that also is dependent on what kind of patients they have. So you're kind of limited. You have very slim pickings. However, in the hospital, you can work on med surg floor, you can work on the cardiac floor, you can work in ER, you can work, you're floating around and and you take on more responsibilities. So you're more at home. Do you see what I'm saying? When you're in nursing school and you have to do your clinical rotations, you're used to doing those things. Imagine a lot of nursing people that you're going to be in school with have never drawn blood. If you work in a hospital, you might actually get to do that. You might actually be trained to do that. There are nursing homes that will not let um, nursing aides, nursing assistants check blood sugar. Seriously, if it's not part of their scope of practice. However, if you work in a doctor's office, again, you have to have been trained to be doing these things before they will let you do them. So please do not go with the knowledge, because that's not what I'm giving out, or go with the impression that, oh, you know what, once I work in the hospital, I just know how to do these things by osmosis. No, my dear, you have to have been trained and return a positive demonstration, and then you're allowed to do these duties. but it would help you in the nursing school when you're actually taught to do these things. Then it's like, oh, you know what? I actually have done this, or I have been around nurses who have done this, and they have trained me or allowed me to watch them do what they're doing. So you're not easily intimidated. But then there are so many other nursing students who do not work in a hospital setting, and they work in a nursing home or even home health care, and they're doing fine. So please, I don't want you panicking or thinking that is the only way to go. If anything, I will say this: working in the hospital is actually going to stress you more when you have to juggle going to school and also working in the hospital, because the hospital can be quite tasking of your time. So that's why you find some nursing students will rather do home health aid, where they have a patient that is stable and they can study. It's the same thing in the nursing home, where they can get stable patients and they are able to study. Because believe it or not, studying is a very, very, very big thing and a big part of nursing school. You got to study. If you're not studying, you're not going anywhere. You can't pass. I don't care how smart you are. It's not easy for you to go through nursing school and think you're just going to breeze through it. You're going to have to do the work. So to me, that's really the difference, you know. So it's up to you what you want to do. Some people want the hands-on, they want the experience, they want the familiarity, they want the comfortability where they're exposed to all these things, and so it makes them more efficient. Maybe it depends on what efficient is, because nursing school is nursing school, medical school is medical school. You're still going to have to do the time. Okay, you're going to have to do the hard work. However, some people like that repetition, where if they work in an environment where they actually do see doctors doing these things, they're helping out. And when they come across those things in school, then it's easier for them. They learn that way, learn by seeing, by doing, and being in that atmosphere. Whereas there are people who just prefer the serenity and the quiet and the stability of nursing homes and home health, where yes, they're not exposed to those type of training and noise and just being around doctors and nurses and all the drama going around them. They need time to study. They need the the quiet to study. So basically, it's entirely up to you. You get to pick. One isn't necessarily better over the other. I think it depends on one, where you find work, and two, your style of learning. Okay, so that's how I see it. I have some of my students who are in nursing school now, and they prefer to be in the hospital because they're going along those lines where after nursing school, they also hope to retain to be retained there as nurses. Another good thing about hospitals, a lot of hospitals do tuition reimbursement, meaning they will, it's in different ways, okay? Sometimes they will pay for you to go on, or they would repay you, you know, like reimburse you. So it depends. When you go find work, you need to read the fine print, not only read it, but make sure you're asking questions. So sometimes people do the hospital route just so they know that they will be trained. The hospital will take on their training and help them along in their careers and, you know, advancement. Whereas in the nursing home, then they, not a lot of them have those type of things in place, meaning tuition reimbursement. And even if they do, it's up to a point. So those are things that you need to be looking at when, you know, you're picking work. You know, you also find people who worked in the nursing home, and then when they graduated, then looked for work in the hospital. It depends on what you want to do. I didn't care much for work in the hospital. I didn't care for a lot of the dramas. And I think where I worked at the time, there was just this one hospital where everyone, it was like the jungle, it was just that hospital, and and everybody wanted to be there. So I didn't find it interesting. So, and then I got this job as a treatment nurse, which gave me some kind of autonomy. I kind of like that. I guess I'm one of those people who work well by themselves. I like that. I liked working with a small unit of people and being effective. And from time to time I will pick hospital, but after a while I was like, it was just, it got to be too much for me. And also I wasn't looking at that time, I wasn't looking to make so much advancement in nursing, if you will. Do you see what I'm saying? It wasn't like a career choice for me. Like, okay, I'm working towards management. I'm working towards, advancing along those different steps. That didn't have an appeal for me. Even till now, I actually don't want or care to be in management. I have been offered that, of course, but I want to have my own thing. I want to have my own business. And so, the hospital path wasn't for me. So, but for those of you who want to be very clinical and want to do some serious advanced progress, and of course work in management, some people want that, they want to be in management and health, nursing and healthcare management. Then you might want to think about hospital, but then you have those that are also in the nursing home. So again, make your own choice. If you want me to talk more about this, if you have questions on how to get into a nursing home or how to get into a hospital, let me know. Things I will be talking about as time goes on, because I'm answering all these questions. There's so many questions, so I'm going to be answering them as we move along the Q&A. So hopefully I'm helping you. If you need more clarity, let me know. Again, this is Nurse Amy. On my YouTube channel, please go ahead and click that subscribe button and the bell beside it so you're notified every time I upload. And of course, follow me on my podcast. Please like me, rate me 5 stars. It's always nice when people encourage and support you. There are many ways to support me. Please go ahead and do so. Something I've also started, and my students have been urging me to say this, so I'm actually going to say it. I do private coaching. So if that's something you're interested in, please feel free to email me directly at nurseamyacademy@gmail.com. Email me what you want. We can figure out how to tailor this coaching to your particular needs. And you can follow me on Instagram and Twitter at Nurse Amy Academy. And please, I have a Facebook. Please go ahead and like my page, Nurse Amy Academy. Thank you so much, all of you, for your support. Thank you. Keep the letters coming. But please subscribe, share my video, and just let people know what I'm doing. As long as it's helping you, please support me. So until I come your way again, always know this: you are the only one that can limit yourself. Please don't do so. Do not do so. And then remember, I am your biggest cheerleader. So until I catch you on the next episode, be kind, be blessed, be safe. So take care and God bless.